So my next guest has some ideas. She wants to save our broken healthcare system, and she thinks this is a good starting point with some tweaks. Joining me right now, former Lieutenant Governor of New York, Betsy McCaughey. Good to see you, as always, Betsy. This has been your platform over the last several years. What is it about this particular plan now that you would tweak and you would change?
Well, first of all, let me tell you what's so good about it. There are a couple of things I would change, but what's so good about it, Section 2202, I haven't heard anybody discuss it, but the big difference between Obamacare and this law is that section, because that section provides a multi-billion-dollar fund sent to the states each year to directly pay the health care costs of the sickest individuals in the individual market. That means that your premiums, the premiums you're paying as a healthy person, won't keep going up, up, up to cover those very sick people.
But the government's not going to pay for them instead?
That's right, but it's much...
You know, that's still effectively us,
Oh,
right?
no, let me tell you. Paying directly the costs of the sick through tax dollars is far cheaper than trying to pay healthy people, subsidize healthy people to buy overpriced insurance. The fact is, the reason that Obamacare premiums have doubled is that the law said you healthy people have to pay the same premium.
Okay, but you're going to then wind up labeling these sick people and putting them in a group?
No, they're going to buy the same insurance and pay the same price. But at the end of the year, it's called reinsurance. The insurance companies will say to the state fund, these were the people that cost more. We're submitting an invoice for them. And then the state government, through using federal funds, will pay
so you
for
like that. You like that a lot.
Very innovative.
That's going to help contain costs.
It will help contain premiums. It will make health insurance affordable for healthy buyers.
Okay, walk me through some of your other, let me just say concerns.
The most important thing is that this is a jobs bill. More than anything else, this repeal bill is a jobs bill. And what concerns me about the CBO report that's coming out later today, they talk about the number of people covered. They talk about the costs. They do not talk about the number of people who will have a job. But the Federal Reserve of New York...
a jobs bill because small businesses have been forced to cut back on employees.
Oh, yes. For example, retailers and other low-margin industries, hotels, right, fast food.
Restaurants,
They were told you must provide the one-size-fits-all, very expensive health plan for your workers. They couldn't afford it, so they pushed their workers down to part-time status. Here's a list of 400 of them, 400 employers who pushed their workers down to part-time status, demoted them, right, so that they wouldn't have to provide the Obamacare plan.
The CEO comes out and says that not enough people are going to be covered via this new program. What do you say?
I'll tell you what bothers me about that. First of all, no one's going to lose their coverage right away under Medicaid, because everyone who's currently enrolled this year, next year, 2019, under Medicaid is grandfathered. They are guaranteed they're not going to be thrown off Medicaid. Right?
And so you're changing it for the future. You're saying, look, you know, you're not going to be able to just live off the dole with Medicaid going forward. You'll have to pay.
Obamacare made a ridiculous promise. Obamacare said to the states, you enroll as many people in Medicaid as you want, and the federal government will pick up 100% of the cost. That's like taking your credit card and giving it to your teenager, right? Nuts.
All right.
So
I know how much you hate. Bottom line, I know how much you hate Obamacare.
No,
I know
that
this is a jobs bill.
We're going to cover everybody under Medicaid.
Is there anything you don't like
about this new one?
Yeah.
Well, there are certain things that couldn't be included because of Senate rules, and they will be included in future bills. For example, purchasing insurance across state lines. Some of the improvements have to come in the future. The Senate rules prevented us from
But it's a very good starting point.
It's a good starting point, especially if you're looking for a job, Trish.
Oh, believe me. Hey, look, we got a
this is going to help you.
We got a good print on Friday. Let's keep up that momentum. We need to keep adding jobs. We need good paying jobs. Thank you so much. Betsy McCaughey, good to see you.